You may think that tan looks good, but you may pay for it later. Not only does the sun age the skin rapidly, but there is also the threat of melanoma, the deadliest form of skin cancer. We spoke to Dr. Kim Charney of St. Joseph Hospital in Orange to find out who was most at risk.
Melanoma is one form of skin cancer, with the others being basal cell and squamous cell is the most common. It's the least common type of skin cancer, but it's the most deadly. There are about 47,000 new cases in the United States each year, and about 7,000 people die each year of melanoma. We know that skin cancers and melanoma are associated with sun exposure, and I think that the number one thing is to avoid the sun. While we can use sunblocks, which are better than sunscreens, sunblocks, one should avoid sun between 10 and 2 during the day. One should consider the type of clothing that they wear. Certainly dark clothing, long sleeves, hats with wide brims are the types of things that we recommend to patients, particularly if you're fair-skinned, blue-eyed, blonde hair, if there's a family history of skin cancer or melanoma. In patients who have a prior history of some type of skin cancer, for example, a squamous cell carcinoma or a basal cell carcinoma, all of these patients are going to be at high risk for the development of melanoma. In the old days, let's say before 6 or 8 years ago, we would do an elective lymph node dissection and take out all of the lymph nodes in a patient's drainage area. That subjected the patient to a large operation, potential risks and complications and morbidity from the surgical procedure. Now we can identify the patients that actually do need to have that operation. So if their lymph node is positive, we'll go back and take out those lymph nodes. But moreover, we don't operate any further on patients who do not have metastatic spread. Additionally, we use that information for offering patients chemotherapy. For example, alpha interferon, or here at St. Joseph's Hospital, we have protocols, one of which includes a melanoma vaccine. We have a full program here at St. Joseph's Hospital. We have dermatologists that are committed to the program. We accept patients from all dermatologists and primary care physicians. We have all of the facilities of a melanoma center right here on the premises. We have our own PET scanner, which is the most advanced PET scanner currently available, which is an excellent technique for identifying metastatic or spread of metastatic disease or spread of melanoma. We have our own dermatopathologists that are committed to looking at skin cancers and melanomas and giving us accurate diagnoses. We have a full array of surgery for this, including the sentinel lymph node dissection, plastic surgeons that are committed to offer reconstructive surgery for patients. We have radiologists that are committed to doing the techniques necessary for identifying the lymph node basins at risk, which is called lymphoscintigraphy. And we have oncologists that are committed to the program to offer the various types of protocols that are necessary for patients that have stage 3 and stage 4 melanoma. So we have the complete array here.